Let's start with question 1. A 25-year-old man comes to the clinic because of severe abdominal pain for 6 hours. The pain began in the periumbilical region and later localized to the right lower quadrant. He has nausea, vomiting, and low-grade fever. On exam, rebound tenderness is present at McBurney's point. Laboratory research shows white blood cell count about 14,000 per millimeter cube, neutrophils about 85%, lymphocytes about 10%, hemoglobin about 14 gram per deciliter, platelets about 220,000 per millimeter cube. The question is, which of the following best explains the initial location of this patient's abdominal pain? Option A, inflammation of the rectum. Option B, irritation of the parietal peritoneum. Option C, stimulation of visceral afferent fibers at T10. Option D, stimulation of the genitofemoral nerve. Option E, obstruction of the sigmoid colon. Now let's start understanding this question by analyzing what this condition about. The patient is said to have pain in the periumbilical region and then in the right lower quadrant. And he also is said to have nausea, vomiting, and low-grade fever. So this condition is typical acute appendicitis. Now let's try to understand the pain. Periumbilical region is the initial location for the pain, and then it later moves to the right lower quadrant. Appendix is derived from the midgut, embryologically speaking. So the pain initially would be a visceral pain, right? So the afferent fibers from the appendix will travel along the sympathetic fibers and reach the spinal cord at T10. So that is where the periumbilical region would be. So the initial pain would be at the periumbilical region. Now, why does it shift to the right lower quadrant? So as the inflammation progresses, the parietal peritoneum covering the appendix would get irritated, and that pain would be somatic pain, right? Initially it was visceral pain and now it's somatic pain. And that location would be right lower quadrant, which is the McBurney's point. So our option would be option C, which is stimulation of visceral afferent fibers at T10. Now let's try to understand why other options are not relevant. Inflammation of the rectum would have pain in the suprapubic region, irritation of parietal peritoneum, which is true, but that explains the later pain, not the initial pain. The question is about the initial location. Why does it occur in the periumbilical region? So the right answer would be stimulation of visceral afferent fibers at T10. Stimulation of genitofemoral nerve would have pain in the groin or scrotal region. And lastly, obstruction of the sigmoid colon would have pain in the left side lower quadrant. Thank you.